Dear patients, infections are presented in medical literature as complication risks that can occur after all types of surgeries. So, is the risk of infection higher or lower in aesthetic surgical procedures? I'm asking scientifically. It is definitely lower and should be lower. Dear patients, let's think with a very simple logic. When operating on a healthy individual, electively, without any health issues or exposure to accidents, you really have to overlook a number of things to be exposed to an infection. So what needs to be done to avoid overlooking these things? Look, these surgeries are a reward for you, because you, as healthy individuals, are applying for these operations to reshape your nose. Consider breast aesthetics and think about facial aesthetics. Essentially, you are looking to boost your own motivation and life energy, and you are entrusting yourselves to us. So, at this point, the first institution you need to trust is the surgeon. The correct surgical conditions that the surgeon must prepare, for you are operating room environments where sterilization conditions are properly maintained from start to finish. So, at this point, the first institution you need to trust is the surgeon. The correct surgical conditions that the surgeon must prepare for you are operating room environments where sterilization conditions are properly maintained from start to finish. So, what is the reason for this? As much as I want to say that my surgeon is very good, yes, I can be very good, but conditions also need to be very good. Therefore, I ask you to please do not compromise on the conditions that are necessary and must be provided for our health. Let's apply to the best places for the best outcomes and strive to have surgery under the best conditions. Especially in our country, we all know that surgeries can be performed in many medical centers and institutions that do not have adequate facilities. Questioning this is primarily your responsibility. Don't just brush it off by saying, my surgeon recommended that place. Please, question the conditions there. In most centers where aesthetic surgeries are performed, there should be environments that include all specialties, have intensive care units, and where the operating room's ventilation, sterilization conditions, and sterilization unit are functioning at full capacity with conscious and experienced teams working. This is the most important point. Let this be the first part. But don't forget to watch the next video for the second part regarding sterilization conditions.